Switching gears to another big economy, the president of the World Bank says China's focus on urbanization and healthcare is helping ease poverty. Yong Kim was speaking to CCTV's Shraysi Tandon at an event here in Washington, D.C. It was hosted by the International Finance Corporation, which is the private arm of the World Bank. The goal was to discuss how private money can do public good. President Kim first addressed talk of a possible slowdown in the Chinese economy.
They're undertaking a huge set of reforms. I mean, they were quite explicit about it. They're moving from a growth model that focused a lot on investment and exports to one that's more focused on services and on sort of knowledge industries. This is a huge shift. I mean, it's going to lead them down a path of what we think is much higher quality growth. But if you were to look at any country that was trying to make that sort of shift, you would expect that the growth rates would slow down just a little bit. Now, in our work with him, Li Keqiang, before he was the premier of China, worked with the World Bank Group in putting together a report called China 2030. And all of the major reforms that we're seeing were really foreshadowed in that report. So what we learned was that when the Chinese government works with you and is serious about tackling a set of issues, we publish something and they actually follow through in a very impressive way. That report was so successful, the first time I met Premier Li, he asked me to do a second report on urbanization. And we just released it. And what we learned is that China has avoided some of the pitfalls of rapid urbanization, but they've got 300 million people coming into the cities over the next decade and a half or so. And they're going to be the first country in the world to have more than 1 billion city dwellers. And they outlined with us in that report some really tough reforms. I mean, the reform of fundamental issues like the hukou system, where you can only get services in the place that you're born. Those kinds of land, labor reforms are going to be tough. Our experience is that when they commit to these reports, when they commit to a vision, they follow through. The next big report that we're going to be working with them on is the healthcare system. And again, they have exploding costs in the healthcare system. They have a huge task of providing healthcare to 1.3 billion people. But what's so impressive is that if they say, okay, we're with you, let's sit down, let's put a plan together, they follow through. Look, we always have to be worried about the largest economies in the world, and it's something that keeps us all up a lot. But I have to say, I've been extremely impressed both with the strength of commitment to the reforms and their ability to adjust over time. So I have a very positive outlook. I think that even if the growth rate falls further, I think that they'll be able to respond in a way that will maintain their commitment to the reforms.
Are you concerned that if the economy in China slows down, that the people that have come out of extreme poverty are going to be pushed back in?
Well, if you look at the issues that China has wanted to tackle with us, right? Urbanization, in other words, there are 300 million rural dwellers, poor people, who are going to move into the cities. And what they asked us to do is to figure out a way for them to build healthier, more sustainable cities that would be able to provide services, education, healthcare to those new migrants. And look at the next issue that we're taking on, healthcare, because they know that this is going to be a huge challenge for them. So my own sense is that they know that they lifted 500 million people out of poverty over the last 30 years, unprecedented in world history. And they know that a huge portion of that was just because of their growth. But now, not only are they focusing on the quality of growth, switching the strategy from one that was so focused on investment and exports, they're also really thinking about how they can more effectively invest in their people. And we know that that's a critical aspect of their own growth strategy. So again, I'm encouraged. I'm just because of the fact that they asked us to work on urbanization and then healthcare, those two facts in and of themselves are also encouraging to me.